I'm Laura Boyd, and welcome to this episode of Beatson Talks, where I am delighted to be joined by the very brilliant Anthony Chalmers. Now, first of all, tell us a bit about yourself and your title.
So my job title is the Chair of Clinical Oncology, and that's at the University of Glasgow and also the Beatson, West of Scotland Cancer Centre. So I see patients with cancer, mainly brain tumour patients, and I also run a research programme.
And that's something I didn't realise. So I live with cancer myself, and I just always thought you had the doctors and then you had the scientists. But there's often very much a kind of crossover there, isn't there?
Well, there's actually not enough of us who do both. We're a little bit of a disappearing breed, actually, for a variety of reasons. But yes, I think, and many of us think, it's incredibly important that the people who are actually seeing the patients are also doing the research and helping to guide the research. You know, these are the important questions. This is what our patients need.
Yeah.
Whereas if you're only working in a laboratory, you may be a brilliant scientist, but you might not have such a good idea about what is actually needed in the clinic.
And it's a fantastic, kind of cutting edge facility that we have here in Glasgow, isn't it?
Oh, absolutely. Yeah. So the Beatson, West of Scotland Cancer Centre, we always say it's the second largest cancer centre in Europe. And it certainly feels like that. It's always incredibly busy. Yeah.
What difference does it make having something like Beatson Cancer Charity, in supporting you and helping to fund research grants?
Well, it's made an enormous difference to our research programme. I particularly would like to talk about the radiotherapy research programme. So nearly half of patients with cancer will get radiotherapy or need radiotherapy at some point. And yet it's only about 5% of the cancer research budget goes on radiotherapy.
Gosh.
So it's really underfunded. And since I arrived in Glasgow in 2010, I think if I hadn't had Beatson Cancer Charity to help kickstart our research programme and then support it, we wouldn't have achieved anything near what we have.
I did not realise that you needed charity support, you needed donations, and it opened up a whole new world to me. It really is vital, isn't it?
It is. There's kind of a circle of funding, which is that if you are a big centre, very well established with a big research team, it's easier for you to get more funding. So if you're in a discipline like radiotherapy that has very little funding, it can be really difficult to get into that and become competitive. And that's really where Beatson Cancer Charity came in. They gave us this, we called it infrastructure funding, so we could appoint research radiographers, we could give some of our doctors 1 or 2 sessions a week to do research, and we could get some technicians working in the lab. And then once they were in post, we were able to do the research that we needed to make a reputation and be competitive for larger scale funding.
Tell me a bit about what it's like to work at the Beatson and have that support of Beatson Cancer Charity, because it's such, I know this, it's a traumatic place to be. It's not somewhere anyone really wants to be. But there's also a warmth there, and the charity is a big part of making it a much nicer place to be than it could be,
I think that's absolutely right. So when we're treating our patients and we're helping them make really difficult decisions and we can see that they're really struggling emotionally or physically, it's just so helpful to be able to say, and Beatson Cancer Charity will be able to help you with this, and this. And like you said, provide a different kind of care, which isn't all about, toxic treatments or desperately trying one thing after another. It's more about quality of life, and it's really supporting both the patient and their family as well. I think that's really important.
And it's everything from a small cup of tea in that waiting room. I love when they come round, you see that trolley and there's I was like, yes, it's biscuit time. But it is such an important thing. I mean, obviously, like the chemo and the radiotherapy is there, and it's amazing what it can do, but it's also these small personal touches that really do make a difference.
Yeah. And one service that I particularly think is really incredible is the helping people get back to work.
Yeah.
which is a relatively recent development. And that, I think, is an absolutely first-rate service.
Mm-hmm.
Another really exciting one, I think, is the programs on fear of recurrence. So for patients who are understandably incredibly anxious about their cancer coming back. And they have a program and it just seems to work amazingly well.
What results do you personally hope to see from the current research that you're doing?
So our research team particularly focuses on what we call cancers of unmet need. So it's cancers where we use radiotherapy and other treatments, and some patients get really good benefit from it, but many patients don't.
Mm-hmm.
So we're really tackling the hardest cancers to treat. So for that includes brain tumours, which is my area, but also pancreatic cancer and lung cancer, for example. What we want to achieve is to firstly increase the range of treatment options for those patients so that we can offer each patient the most appropriate treatment for them. And then secondly, we want to fine-tune that treatment so that each person gets the maximum amount of benefit. And we hope that will increase the number of patients who are cured. We acknowledge that that's, for some cancer types, that's a little way off.
Yeah.
But for those patients, we want to increase their survival, help them live longer, but also make them live better, so with better quality of life as well.
And what do you think the future of research will look like?
So increasingly, the direction is towards individualized treatment. So for many years, if you have a certain diagnosis, you get given a certain treatment. And like I said, for some people that works and for some people it doesn't. Mm-hmm. What we're all about now is finding out as much as we possibly can about each patient and their tumour and using that information to tailor a treatment specifically for them. And we think that approach will give us much better success rates and also reduce the amount of unnecessary treatment.
Yeah.
Some patients get more treatment than they actually needed, and so they get some side effects that they didn't need to have. So it's both those things, making it more effective against the tumour and wherever possible, causing less side effects.
Which will be fantastic. We all want that. When I started my treatment for chronic myeloid leukemia, now I was first diagnosed and you're understandably terrified, and I was put in the very safe hands of Professor Tessa Hollyoak, who's sadly no longer with us. She had cancer herself and sadly passed away. But she gave me this incredible sense of safety and that everything possible was being done for me and that I was in the best place, being in the Beatson. And there was a real sense of that. And I know a lot of people I speak to feel that same thing, that when you hear you're going to the Beatson, there's a sense of safety there because it has such a good name. And all I've ever felt from the likes of Professor Hollyoak and any doctor or nurse that I've seen is that they just want to do the best for you. Do you get that sense from your colleagues as well, that there's a sense of pride?
There's absolutely a sense of pride, 100%. And I actually think research plays a big part in that. So if you're in a centre that's running lots of clinical trials and where the doctors are actually involved in research and even running their own trials, you know that means that it's at the cutting edge. And actually there's evidence to support that even if you're not in a clinical trial yourself, if you're being treated in a centre that runs lots of clinical trials, you're going to do better. So that's a big part of why research is so important as well.
Yeah, and I really did feel that sense being there and still do every time I go. Almost 15 years later, well, I'm proof that, that these things work. And I think because with chronic myeloid leukemia 15 years ago or so, or 20 years ago, things would have been very different. I might not have been here, so it's proof that research is vital. There must be some incredibly difficult moments of your career, but what have been some of the standout positive moments?
So one moment I will never forget was the first time I recruited a patient into a clinical trial that I was actually running myself. So I'd done the work in the lab, then I'd written the trial protocol, and it came to actually asking a patient if they wanted to participate in the trial. And I was totally unprepared for that moment. I had a complete out-of-body experience. You know, when people talk about being on the ceiling, looking down, that happened 100%. And I totally messed it up. I was so hyper aware of not wanting to put any pressure on them that I just kind of made it sound so unattractive that they didn't they didn't participate. And I thought, okay, I've got to get a slightly better balance than that. So that was a bit of a milestone. I think when you complete a clinical trial and you find something new that will help other patients, especially with a disease like glioblastoma, which is the brain tumor that I treat, that's an amazing feeling. And you can see it having an impact, not just in your own patients, but internationally. Yeah. So that is, that's the highlight really. And hopefully there'll be more of
those to come up. Well, what has been the most impactful result then that you've seen in your years of research?
So that first trial, we wanted to use a drug to make radiotherapy more effective against the brain tumor. But the research that had been done, mostly in animals, to be honest, had indicated that this drug wouldn't get into the brain and therefore wouldn't be effective. Mm-hmm. So we had reason to believe that it would in humans, not mice. And so we ran this trial. And the first part of it was to see whether this drug got into the tumors. And we showed that it did in every single one of the patients.
Yeah.
And so that sort of took away a big barrier that had been preventing lots of drugs from even being tested in brain tumor patients. So that was probably the most important thing so far. And now we've got that drug and some other drugs in combination with radiotherapy, and we're really optimistic that we'll actually improve life expectancy for those patients. So that's the next big challenge.
Which will be amazing. You're so busy with the clinical side and the research, and it's such an important job. Are you able to switch off from it ever? And how do you do that?
How do I switch off? No, I'm very fortunate. I've got lots of hobbies that I keep going at some level. I love gardening, and I love making cocktails and then drinking them.
In the garden?
Ideally in the garden, in the sun, yeah. I play the piano. So, yeah, I think having those other things has really helped me keep going, because it is true. There are times when I do feel not sure how much longer I can keep this up, but there's that side. Then the other thing is coming into the clinic and seeing patients.
Yeah.
And it's like, well, of course I've got to keep going.
Yeah. There are patient stories that stick with you, or certain patients that stick with you.
There are so many.
Yeah.
So many. Which I think is good, because I think if there was only one or two, that would make it somehow more difficult. But because there are so many, and everyone's story is different, and their families are different. You know, the stories are just so extraordinary that it's endlessly motivating. And yes, it means that it isn't just one or two patients that you focus on. It's everyone, which I think is obviously very, very important.
Yeah. And I think, you know, the work you do and the professors and the doctors do sticks so much with the patients. And for me, my own little girl who was born via surrogacy due to cancer, and you know, Professor Holyoake was very key in kind of getting me on that journey. So my own little girl's middle name is Tessa, after Tessa Holyoake.
Amazing.
And it just shows you, though, the impact and the importance that people like you have in our lives, which is incredible.
I try not to think about that too much, honestly. Because it's already quite a responsibility. And I think if I allowed myself to think too much about that, I would find that a bit difficult.
Yeah.
So thanks for telling me, but I'm just going to forget about that.
Blank that bit out. But it's I think it's nice to know that you do, you know, the people that you mean so much. When you started out in medical school, did you imagine this is where you would be?
100% not.
What was the goal then?
I just wanted to be a good doctor.
Yeah.
And I started research very late in my career. So I knew I wanted to be an oncologist, and I'd done most of my oncology training. And it was actually something very specific about how radiotherapy affects cells that got me, for the first time, made me want to do some research in the lab. And so the sort of first phase of your research training is doing a PhD. Mm-hmm. I got my PhD when I was 37. And it was only after that, really, that my research career began, which tells you how old I am now.
I'm not working it out in my head, honest.
But yeah, I came late to research, and I came to it very much through seeing and treating patients, which I think has been a good thing. And I'm always driven by those questions. What do the patients need us to do better? Whereas some scientists, quite rightly so, come to it because they're fascinated by a molecule or by, something very, very specific. And there's a huge need for that. But I think there's also the need, as I said before, for doctors who are seeing patients to be doing research as well.
Yeah.
I'm so grateful because it's been so rewarding.
Yeah.
And, I see some of my colleagues of the same kind of age who've been treating patients every single day, every week for the whole of their careers, and understandably are struggling a bit. Mm-hmm. Whereas I think because my job is so varied and the research keeps changing, I haven't struggled with that.
And hopefully it gives you a chance to see the future, that things are changing and developing, and you're kind of at the forefront of that.
Yeah, and even if it doesn't work, you'll still have done things that have made a difference. Mm-hmm. Part of that is something I really love, is helping sort of more junior researchers develop and supporting them through what I know is really difficult, for doctors who want to do research. Trying to combine all of that in a career is really challenging. So I really relish the opportunity to help those people get through that process and flourish.
Yeah.
And so, if I don't find a cure for glioblastoma, maybe one of them will.
If you would like to support or be supported by Beatson Cancer Charity, then go to beatsoncancercharity.org.